If you're over 60 and you snore loudly every night, you need to hear this immediately. Recent studies show that untreated sleep apnea increases your risk of heart attack by 300% and stroke by 400%. What's even more alarming is that 80% of people with moderate to severe sleep apnea don't even know they have it. They think it's just normal aging, but it's not. Your heart is working overtime every single night, and most doctors never connect the dots between your sleep problems and your cardiovascular health. I'm going to share 7 warning signs that could literally save your life, and the most important protection strategy is at the end, so please don't click away. Here's what most people never realize about sleep and heart health after 60. When you stop breathing during sleep, even for just 10 to 30 seconds at a time, your blood oxygen drops dramatically. Your heart has to pump harder and faster to compensate, your blood pressure spikes, and stress hormones flood your system. This happens dozens, sometimes hundreds of times per night. Imagine running sprints in your sleep without knowing it. Your cardiovascular system never gets to rest and recover like it should. The good news is that once you recognize the signs and take action, you can dramatically reduce these risks within just a few weeks. How old are you right now? Write your age in the comments because I personally reply to everyone, and I want to give you age-specific advice based on where you are in life. Let me tell you about the first warning sign that's often completely overlooked. Loud, disruptive snoring that stops and starts throughout the night is not just annoying to your partner. When your snoring suddenly goes quiet for 10 seconds or more, then resumes with a loud snort or gasp, that's called an apneic event. During those quiet moments, you're actually not breathing at all. Your brain is desperately trying to wake you up just enough to restart your breathing. For people over 60, this becomes especially dangerous because our throat muscles naturally weaken with age, making airway collapse more likely. The scary consequence is that each time this happens, your heart rate can jump from 60 beats per minute to over 100 beats per minute in seconds. That's like doing cardio exercise while you're supposed to be resting. If you recognize this pattern, start sleeping on your side instead of your back, and elevate your head with an extra pillow. This simple change can reduce snoring episodes by up to 50% for many people. The second critical sign is waking up gasping or choking in the middle of the night. Many people over 60 dismiss this as just getting older, but it's actually your body's emergency response to dangerously low oxygen levels. When your airway becomes completely blocked during sleep apnea, your blood oxygen can drop below 90%. For comparison, healthy levels should stay above 95%. Your brain triggers an urgent wake-up call to force you to breathe again. The cardiovascular impact is severe because each gasping episode causes your blood pressure to spike dramatically, sometimes reaching dangerous levels, even if your daytime blood pressure is normal. If this happens to you more than twice a week, it's time to take action. Try doing simple throat exercises before bed. Stick your tongue out as far as possible and hold for 10 seconds, then move it side to side 10 times. These exercises strengthen the muscles that keep your airway open during sleep. Morning headaches that seem to come out of nowhere are the third warning sign, and they're directly connected to your heart health. When sleep apnea causes your oxygen levels to drop repeatedly during the night, your brain blood vessels dilate to try to get more oxygen-rich blood to your brain tissue. This dilation creates pressure and pain that you feel as a headache when you wake up. But here's the dangerous part for your cardiovascular system. The same process that causes these headaches is also forcing your heart to work much harder all night long. Your heart muscle becomes stressed and enlarged over time, leading to heart failure in severe cases. Research from the American Heart Association shows that people with untreated sleep apnea have twice the risk of developing heart failure compared to those without sleep disorders. To address morning headaches naturally, try this simple routine. As soon as you wake up, drink a full glass of water and do 5 minutes of gentle neck stretches. Dehydration makes headaches worse, and gentle movement helps restore normal blood flow patterns. Excessive daytime sleepiness that interferes with your daily activities is the fourth sign, and it's more serious than most people realize. When sleep apnea fragments your sleep with constant wake-ups, you never reach the deep restorative sleep stages your body needs. For people over 60, this creates a dangerous cycle. Poor sleep increases inflammation throughout your body, including in your blood vessels and heart. Chronic inflammation is a major risk factor for heart disease, stroke, and even dementia. Studies show that people with untreated sleep apnea have inflammatory markers in their blood that are 3 times higher than normal. The cardiovascular consequences include increased plaque buildup in your arteries and higher risk of dangerous blood clots. If you find yourself falling asleep while reading, watching television, or during conversations, don't ignore it. Try taking a 20-minute power nap between 1 and 3 in the afternoon, but never longer than 30 minutes. This can help you feel more alert without interfering with your nighttime sleep patterns. Difficulty concentrating and memory problems during the day represent the 5th warning sign, and they reveal what's happening to your brain and heart during disrupted sleep. Each time your oxygen levels drop during sleep apnea, your brain cells are temporarily starved of the oxygen they need to function properly. Over months and years, this leads to actual changes in brain structure, particularly in areas responsible for memory and decision-making. The connection to heart health is profound because the same oxygen deprivation that affects your brain is also damaging your heart muscle. Research published in the Journal of the American College of Cardiology found that people with sleep apnea have significantly higher rates of irregular heart rhythms, including atrial fibrillation, which increases stroke risk by 5 times. To protect both your brain and heart, try this cognitive exercise combined with deep breathing. Spend 10 minutes each morning doing simple math problems or word puzzles while practicing slow, deep breathing. This helps retrain your brain to function better with improved oxygen flow. The 6th warning sign is frequent nighttime urination, and most people never connect this to sleep apnea or heart problems. When your oxygen levels drop during apneic episodes, your heart releases a hormone called atrial natriuretic peptide. This hormone tells your kidneys to produce more urine, which is why you wake up needing to use the bathroom multiple times per night. The cardiovascular danger is that this hormone release indicates your heart is under significant stress. Your heart muscle is stretching and working harder than it should, similar to what happens in early heart failure. People with sleep apnea typically wake up to urinate 3 to 5 times per night, compared to once or not at all for people with healthy sleep patterns. If you're experiencing frequent nighttime urination, try stopping all fluid intake 3 hours before bedtime and empty your bladder completely right before getting into bed. Also, avoid caffeine after 2 in the afternoon, as it can worsen both sleep disruption and nighttime urination. The 7th and most overlooked warning sign is mood changes, particularly increased irritability, anxiety, or depression. Sleep apnea doesn't just affect your body, it profoundly impacts your emotional well-being and mental health. The constant stress of oxygen deprivation during sleep triggers the release of cortisol and other stress hormones throughout the night. For people over 60, this creates a perfect storm for cardiovascular problems because chronic stress is one of the strongest predictors of heart attack and stroke. High cortisol levels increase blood pressure, promote dangerous belly fat accumulation, and make your blood more likely to form clots. Studies show that people with untreated sleep apnea have cortisol levels that remain elevated even during the day, when they should naturally be lower. The emotional toll is significant too. Imagine trying to cope with daily life when your body has been in fight or flight mode all night, every night. To break this cycle, try practicing gratitude before bed. Write down 3 specific things you're grateful for each night. This simple practice helps lower cortisol levels and can improve both sleep quality and heart health within just 2 weeks. Let me share the most important protection strategy I promised you at the beginning. The single most effective thing you can do, starting tonight, is to sleep in what I call the cardiac protection position. Sleep on your left side with your head elevated 6 to 8 inches above your heart level. This position uses gravity to keep your airway open, reduces the work your heart has to do, and improves blood flow back to your heart. Place a pillow between your knees to keep your spine aligned and prevent rolling onto your back during the night. This simple position change can reduce sleep apnea episodes by up to 60% and lower the cardiovascular stress on your heart immediately. Remember, loud snoring, gasping during sleep, morning headaches, daytime sleepiness, concentration problems, frequent nighttime urination, and mood changes are not just normal parts of aging. They're warning signs that your cardiovascular system is under serious stress every single night. Your heart was designed to rest and recover during sleep, not work overtime fighting for oxygen. The connection between sleep apnea and heart disease is real, it's dangerous, and it's often completely preventable with the right approach. Your body has an amazing ability to heal and recover when you give it the support it needs. Even small changes in your sleep position, evening routine, and breathing patterns can make a dramatic difference in just a few weeks. You're not powerless against these problems, and you're definitely not alone in dealing with them. Take action on at least one of these strategies tonight. Your heart will thank you for it, and you'll likely start feeling more energetic and clear-headed within days. Remember that protecting your cardiovascular health through better sleep is one of the most important investments you can make in your quality of life and longevity. If this information opened your eyes to the serious connection between sleep problems and heart health, please hit the like button and subscribe for more life-saving health content. Turn on notifications so you never miss important updates that could protect your health. Share this video with friends or family members who might be experiencing these warning signs, because early recognition can literally save lives. Which of these 7 warning signs surprised you the most, or what other health topics would you like me to cover next? Write your thoughts in the comments below, and I'll personally respond to help you with your specific situation.